You've received the diagnosis of psoriasis, and you're wondering, what's the next step? You've seen commercials for different medications, you've seen different tubes of things. How do you know which one is the right one for your psoriasis? Hi, I'm Sarika Ramachandran, a board-certified dermatologist. Today, we're going to talk about finding the right treatment for your psoriasis. There's a lot of different diagnoses in dermatology, and so it's important to first of all make sure that the diagnosis is clear. There are other things that can sometimes look like psoriasis that are not psoriasis, things that are pink and scaly. Sometimes if it's not exactly clear, sometimes we do skin biopsies. So taking a small sample of the skin and sending it to the pathology lab and see at the cellular level whether there are things that indicate that this is psoriasis. So there's a few different things that go into thinking about how best to approach our psoriasis patients. And that includes, is there any past history that would help gear us towards using a certain type of medication or help gear us to not using a certain type of medication? Is there a certain part of the body that's involved? Or a large part of the body that's involved? Maybe a topical medication would help us in a small area that's involved, but if we have a large area of psoriasis, then that may require something more than that, or a systemic treatment. Is there anything to indicate maybe there's a component of psoriatic arthritis involved? Are you having joint pains? Are you having swelling of the fingers? And that's where your physician can help figure out whether or not that will influence which medications would be helpful. Sorry, just cut me off if I'm talking for too long. In terms of psoriasis treatment, this is a really exciting time and a hopeful time because there have been many new treatments that have come out for psoriasis in the last decade, 2 decades. These are kind of the 3 broad categories. So we have topical medications that are applied. We have systemic medications that can be taken by mouth or injected. And then we have phototherapy, which can be used for psoriasis. When we're thinking about psoriasis limited to a small body surface area, using topical steroids is one of the first things that we start with. In addition to topical medications that are steroids, there are also non-steroids. Sometimes we will start with topical steroids, and as a patient obtains some control over their psoriasis lesions, we will add in some of the non-steroidal topical medications to decrease the amount of topical steroids that a patient needs to keep the disease under control. So there are vitamin D analogs, there are calcineurin inhibitors, and then we have newer medications that have come out that include aryl hydrocarbon receptor modulators and others as well. So those are some of the topical medications. Sometimes we have psoriasis that can be more extensive. There is a lot of body surface area involved, or it's not responsive to the topical medications. And that's sometimes where we add in some of the more systemic medications. So these systemic medications can be oral, they can be injection subcutaneously, or they can be received IV. Some of these medications can be immunosuppressive medications, which can offer broad immunosuppression that can help with psoriasis. And in the last few decades, we've been using medications called biologics, which tend to target a specific portion of the immune system. So treatments can vary. Sometimes patients require multiple different kinds of treatments. So we sometimes combine using topical medications with systemic medications as well. Sometimes we use multiple systemic medications to get things under control. In dermatology, one of the neat types of treatments that we have is phototherapy. Phototherapy is where we use ultraviolet light essentially to help control certain diseases, including psoriasis, but it's actually been used for other diseases as well, which include eczema, vitiligo, and others. In some offices, we have a light box. We have narrowband ultraviolet light that can be administered to large areas of the skin Some patients actually can get a home light box. The treatment with the narrowband ultraviolet light tends to, at least initially, occur 2 to 3 times a week, and then you stay in the box for a certain amount of time. And when we're talking about the narrowband ultraviolet light, it's a specific wavelength of light that's administered. So this is very different from, say, just going out and getting exposure outside or going into like a tanning booth. So this is a really important distinction to make, because you want to make sure that you are under the guidance of a physician if you're doing phototherapy and you're getting the right treatment. Looking for more advice on psoriasis? Sign up for our newsletter in the description box. I think one of the hardest things about treatment is that it doesn't always show up as being effective within a day or two. Sometimes in psoriasis, when we're using topical medications, we can notice that within a few weeks, we're starting to see improvement of our lesions, especially if the disease is limited, if it's a small lesion, things like that. Sometimes with more extensive disease and some of our systemic treatments, we might start to see some changes in the positive direction within a few weeks, but to see more effects, it may take months, 3 months, and sometimes even 6 months to really see a big difference. So some of the ways that we measure how psoriasis is responding is looking at the lesions. Is the scale going away? Is if it's red or purple, is that color changing back to the normal tone? Sometimes we can get hyperpigmentation or darkening even as lesions are healing, so we keep that in mind. We also look and see if the body surface area total is changing, meaning the areas where we have active psoriasis is decreasing. So if we're seeing that starting to improve, in patients who have psoriatic arthritis, seeing whether the arthritis is improving. So those are all different ways that we can measure whether or not psoriasis is improving. What are some of the lifestyle considerations that you need to be thinking about when you're selecting treatment? Everybody is different, and so these considerations will be different for everyone. So thinking about how, if you're getting a treatment, whether you can actually use it, whether you can actually take it. So for topical medications, being regular about applying medications is important. Being able to get to the areas of psoriasis. Sometimes patients have lesions on the back, and so trying to get to those lesions can be challenging. We do sometimes recommend, using like a spatula to get to hard to reach areas, so that can be helpful. With phototherapy, if you're thinking about doing phototherapy, whether or not you can actually go to a facility to get treatment, if that's your option, is important, because if there's a facility but it's an hour away and you have to go 2 or 3 times a week, that might be really hard with work and other things that come up in life. So making sure that you're actually able to complete the treatments that are being recommended is really important. Other considerations are for systemic medications. So some of the systemic medications entail getting injections. So making sure that you're somebody that would be comfortable receiving injections and being able to get those injections on a regular basis when you need them. When we're thinking about doing some of our systemic medications, some of them can be suppressive to the immune system. And these medications, it's important to consider whether there are any underlying infections. If you are in scenarios where you may be more predisposed to getting infections, whether there may be any underlying conditions such as malignancies or history of certain types of malignancies that need to be considered when choosing those medications. The other things that you want to think about is your reproductive status. If somebody is thinking about becoming pregnant in the near future or is already pregnant, that can also affect what may be an appropriate treatment at that time. Those are all things to consider, and your physician will also look at your background history to see if you're an appropriate candidate for some of these treatments. In psoriasis, there's no cure, but there are so many things we can do to help improve it. Every individual is different. No one treatment may be the right treatment for everyone, but there are a lot of treatments that we have the availability to try, and it's important, if something is going on your skin, to get it checked out. Thanks so much for watching. I'm so glad you're here. For more information on psoriasis treatment, like and subscribe.